everyone, welcome back to my channel. If you're new, then a massive welcome to you. My name is Dr. Baptiste. I work as a portfolio GP or a GP with a portfolio career. In the next episode of Just What Can a GP Do, we will be speaking to Dr. Tristan. He is an aesthetic or cosmetic doctor, and he's also the founder and CEO of Harley Academy. In addition to the above, he's also a clinical mentor at the NHS Institute for Innovation and Improvement. Now, this is not a typical episode because Dr. Tristan is not a GP. However, many GPs do work in cosmetics or aesthetic medicine in addition to their clinical duties as a GP. Also, in the poll I posted on my community tab, revealed that you guys wanted aesthetic medicine. In fact, 31% of you voted for this as one of the next episodes in the series. So in this video, Dr. Tristan will detail his own career journey into aesthetics. He will also discuss the earning potential of this specialty and of course a bit about the Harley Academy. He also discusses ways in which you can start a career in aesthetics. As always, if you enjoyed the video, then make sure you give it a thumbs up. And if you haven't subscribed, then make sure you do. Check out all the other videos I have on my channel. So let's get into the video.
Hi everyone, my name is Dr. Tristan Mehta and I'm a full-time doctor working in aesthetic medicine. And I started a company called Harley Academy in 2015. And since then I've been working on creating an education standard for doctors, dentists and nurses looking to get trained in aesthetics. I'm very happy to talk to you all about the different modalities within aesthetic medicine, the definition of aesthetics, and a bit more about my journey in aesthetics. So I graduated in 2012 and I was working as a junior doctor when I first did my training course in aesthetics. So I did a Botox and fillers foundation course over a weekend and I absolutely loved it. And what I didn't realize at the time was what the standard of training should have been like for me to feel like I was confident and proficient at the treatments that we offer. And so knowing that, I kind of went from that one-day course into my first treatments without a mentor and learnt the hard way about what it really takes to build a career in aesthetics. And I started off trying to start my own small business with partnerships with local medi-spas and salons, for example, and ultimately became really interested in the education side of aesthetic medicine. And there was a very important governmental review in 2012, the KEO report, which looked at cosmetic interventions and looked at the standards required to train properly in aesthetics. And in 2015, Health Education England released guidelines for how doctors, for example, should be qualified in order to practice injectables. And the qualification standard recommended what's called a level 7 standard, which is a postgraduate diploma. So in order to practice injectables, the recommendation was actually you have to be, first of all, a healthcare professional like doctor, dentist, nurse, and then you have to do a diploma on top of that. And I was following those guidelines and became really interested in how we could actually drive up standards and how we could actually create a better training environment for the thousands of practitioners that are looking to get trained. So then my journey then moved to Manchester and I completed my own diploma in skin aging and aesthetic medicine at the Manchester University. Whilst I was doing my diploma, I was also building a qualification. I was writing a specification and working with an awarding body to try and release the first qualification for injectables. And that's what we did in 2016. So in 2016, we launched this level 7 qualification and I moved to London at that time and started working in a clinic in London as well. And by then I'd completely stopped my locum work. So I was working in A&E as an SHO and then a middle grade in emergency medicine whilst I was building my career in aesthetics. And I found that I could sustain myself through my clinic job and the very small business that I was able to run in 2016, which was myself and my first employee, whilst we started to deliver some of this training. But what happened in 2016 was the standard that we created, this level 7 qualification, became very popular, and we started to sell 10 of them a month, and each of those, were practitioners looking to commit to a year's worth of training in aesthetics. And so with that revenue, I could then start to think about how to build an organization around this. So we started building an operations team, a clinical faculty. We built a sales and marketing function. We built a technology platform to be able to deliver the qualification. We built an education function so we could start to bring in subject matter experts and build really brilliant learning content. And to cut a long story short, over the last 4 years, Harley Academy has grown to become the largest education provider for aesthetic medicine for healthcare professionals. We have over 30 level 7 enrollments every month, and we train thousands of healthcare professionals who want to commit to doing injectables and skin rejuvenation treatments properly and future-proof against future changes to regulation. Now, these regulatory changes, that they're still guidelines, so you can start a career in aesthetic medicine just by doing a one-day course like I did the very first time. And we talk about this a lot. Obviously a false sense of security from having a small amount of insight into what aesthetics is about. The question that I get asked the most is the market saturated? And what does it take to really succeed and to grow and have a busy, successful practice in aesthetics? And for a while, I struggled to answer that question because I didn't have enough data and I didn't want to give people the wrong information. I've been practicing this for at least 7 years now. Most of that has been full-time teaching and injecting. And I can tell you that there are more patients than ever looking for treatments. And the thing that will differentiate one doctor from another is their ability to retain clients and to develop traction through word of mouth. But this is the main point. There are two kinds of consultations that are happening in the UK right now. The first type is a transactional consultation, which is like you're working as a technician. So you've done your basic training in Botox and fillers, and your patient comes in, looks at a treatment menu and says, "I'd like my lips doing, please." And you say, "Okay, great. That's £250. Here's the consent form. Sign here." Maybe I'm doing this on a Saturday and I've got 10 patients booked in, and I will treat my patients, and maybe I'll make £2,000 in a day, and I'll be very happy. The problem with that is that because you're trained to do Botox and fillers, and you're a fillers doctor, you are reducing your depth of knowledge and your perceived value to be that of a technician. So you can deliver the treatment and you can maybe even get a really nice result, but you're missing the crucial aspect of what it really takes for some practitioners to succeed. And I'm going to elaborate on that. We're in December, and right now, December is one of the busiest months for injectables. And there's some practitioners that have queues of patients all the way through to January. And there are some practitioners that are doing discounts left, right, and center, which, by the way, you can't do for ethical reasons. And the reason why some practitioners succeed is because they're working as a specialist. And this is the solution to that anxiety is the market saturated? How do I succeed? How do I find patients? The answer is, when you're working as a specialist and maybe the same patient comes in and they say, "I'd like my lips treating, please." And maybe you've got your menu, maybe it's still £250. The difference is we will then have a consultation and we will take a history and we'll understand from that patient exactly why they want their lips treating. Have they had it before? Who with? Which products? What their main concerns are? What their ideas are for their aesthetics? Factor in, how old they are into potentially what treatments they want, and then we examine our patients and we look at them with our eyes as the clinician, as the experts, and we can make an assessment as to how their proportions are, talking about how far within the aging process they are, perhaps which areas have lost volume. We can talk about skin treatments. And then the magic is then designing a treatment plan with that patient in partnership, which will ultimately not be lip fillers today. It might be, we need to focus on the mid face today, and we'll work on this. And then in 3 months' time, we need to come back and do this. And by the way, your homework is to take this skincare home and give them proper advice about how to look after their skin at the same time. The truth is 95% of practitioners across the UK right now aren't capable of doing that, and they don't understand truly what they're doing. If you ask them why they're doing a certain treatment, they'll say, that's how I was taught, or I'm trained to do that, don't worry. But what they won't say is, I'm using this product in this layer of the face. If we apply those principles to aesthetics, then your patients immediately resonate and recognize your level of expertise and your confidence, and they have that trust in you, and you deliver a better outcome, and will tell their friends, and that's how you become a busy, successful practitioner. And the biggest trap in aesthetics is thinking that you can do a short course over a weekend, and then maybe the week later, you'll learn some of the more advanced treatments. You can start your Instagram page, you can start getting your patients through the door. And that is a trap. You'll spend thousands of pounds. You won't have any skills or knowledge. You'll have a dangerous false sense of security and get any traction, and you'll give up, and you'll have basically decided for yourself and had a self-fulfilling prophecy that it's too competitive. Okay. Whereas in actual fact, what you need to do is take a view. Aesthetics is a specialty. It will take you 5 or 6 years to get to a very experienced consultant level. And it's an experiential journey. And maybe for the first year, you're just doing the fundamentals, building a client base, learning how to market yourself, learning the fundamentals of a business. And then only when you're ready, and you can, the rule is, by the way, when we're teaching a lot of practitioners, only move on to a certain area when you can confidently describe the anatomy of that area. Again, 99% of practitioners don't understand the anatomy of all the areas they're talking about. They simply can't give you an intelligent answer as to what's underneath the skin there, but they're putting filler in there anyway. And so we've got it all backwards. And that correlates with the often bad outcomes that we see and the botched job stories that we see, not just from the beauty therapists doing this, but also the medics that are doing this badly. So there is unfortunately no shortcuts, and we have to view aesthetics as a separate career pathway. But what I can tell you is that if you choose to do things properly and you commit to this as a new career plan, aesthetics will give you all of that autonomy that you're looking for. It will take time. You'll eventually build your client base. You will have the earning potential that you want to have, whatever that might be. And in the process, like I did, I hope, you will learn that aesthetics is a really enjoyable field to work in. It's extremely creative. We still get that wonderful feedback from our patients when we deliver them an outcome and significantly improve their quality of life. You have to be compelled to want to enter a new field. Dipping your toe in the water doesn't really cut it, and you won't really get very far down the road. But if you know it's right for you, then nothing will stop you from ultimately becoming successful in aesthetics. The question there on the earning potential in aesthetics, I know I've just touched on this. So if you think about a typical treatment, you may want to charge, let's say, £300 for Botox treatment or for a dermal filler treatment. Your product costs are up to £100 for that. And then you've got to factor in your overheads, like the room that you're renting, your insurance, and things like that. So being very conservative, you could probably say that your margin was £150 per treatment. Now, that's, you can do a treatment every 30 minutes, every 45 minutes. And if you're busy, you can see 6 patients in an afternoon, 12, 15 patients in a day. So you can very easily see how this could amount to at least, you know, £1,000 to £2,000 of profit take home per day. But what gets really interesting in aesthetics is when you start to layer in the different treatments. So, and it's all stuff that's ultimately good for your patient. So, talking about skin and having retailable skincare that you can talk about for protection, retinols, alpha hydroxy acids. You can do in clinic chemical peels and microneedling, for example. But then, of course, when you get more advanced, you can start thinking about multiple mils of filler per patient. And so if I have a 50-year-old that's looking for rejuvenation treatment and is concerned about volume loss, then I will immediately start thinking, I'm going to need at least 5 mils to do this properly. And maybe break it down between this session and another session. And then on top of that, maybe you'll need some Botox and some skin treatments. But when you structure a consultation like that, then you're looking at quoting a price of up to £1,500 for that treatment. And you can see that if you have multiple cases like that in a day, which will come in time, not immediately, you won't know what to do with 5 mils in your first few months of practicing. Then you will really start to see the earning potential in aesthetics come about. It's worth mentioning, I work harder now than I've worked at any stage in my career. It's certainly not, an easy road, but it is extremely fulfilling, and that's not because of the earning potential. That's because of the interactions.
I hope you've got some tips and get started. I will see you in my next video.